the student PA. Is it alright if I talk to you today?
Yes.
Perfect. Can you confirm your name and date of birth for me while I wash my hands?
My name is Amanda D'Souza. I was born February 7th, 1998.
Perfect, thank you.
Mm-hmm.
So what brings you in today?
I have been having low back pain for about 3 weeks.
About 3 weeks.
Mm-hmm.
And do you know what you were doing when that back pain first started?
I don't know what I was doing when I noticed it, but I think a few days before I was helping my friend move.
Okay.
Mm-hmm.
And where on your back is the pain located?
Kind of like generalized low, just like the entire area,
Okay.
not a specific portion.
Okay. And how would you describe that pain?
It's kind of just like a constant, it's almost like a soreness. It kind of like limits my mobility. It kind of, other than that, I don't know how to describe it per se.
Okay.
Like it's kind of dull, I guess. Yeah, it's dull. It's not really sharp unless like I move quickly.
Okay.
Yeah.
And on a scale of 1 to 10, 10 being the worst pain you've ever felt, 1 being almost no pain, how would you describe it?
So I'd say it's like typically at a 4,
Mm-hmm.
but if I do something that aggravates it in the moment, it can get up to about a 7.
7. Okay.
Mhm.
And so what does aggravate it?
Like if I twist or bend down, that really hurts. So I try not to do those movements
Okay.
as much as possible.
Have you noticed anything that makes it better?
It improves a little bit with Tylenol, but overall, nothing else makes it better. I've tried like heating pads, but no improvement from that.
And how much Tylenol did you take?
Just took the regular over-the-counter amount by the bottle itself.
Okay. And have you tried any other sort of alternative medicines or anything with that?
I tried, some of those gels that you use,
Like
for like
the
muscle
Isola?
soreness. Yeah, for like the muscle soreness. But I didn't really do much either.
Okay. Any other medications you took or anything like that?
No, can't think of anything else that I've taken or
Okay.
used.
And did you see another doctor or go to urgent care for this back pain?
No, I thought it was gonna resolve on its own, but it's been a while, so I was like, nah, I need to get it checked out.
Okay. And you said it's constant. Does it ever fluctuate in and out, or is it just constant only when it's sharp?
It's constant, and then it gets worse whenever I do those certain movements. Other than that, like it's mildly improved by the Tylenol, but
Okay.
yeah.
All right. Perfect. And then, have you noticed any sort of heat in the area?
Like if it's warm
Like
and
hot
stuff.
to the touch?
No, it's not. Not that I've noticed.
Have you had a fever?
No, I haven't measured my temperature, but I haven't felt feverish.
Okay. What about swelling?
No swelling. No.
Okay. Any numbness or tingling?
No, I get like some tingling in my fingers occasionally, but that's I think due to sleep. If I'm sleeping in a weird position, I don't think that's due. It happened before the back pain. It's not. I don't think it's part of this.
Okay, perfect.
Yeah.
Any sort of popping when you move or anything like that? Okay. Are you having any neck pain or stiffness?
No neck pain.
Any headaches?
When the pain gets when it gets too much, then I'll just get a little bit of a headache.
Okay.
But that improves with Tylenol. Like that when I take my Tylenol, it resolves.
Okay. And have you noticed any loss of vision or anything like that? Okay, perfect. All right, so I'm just going to summarize this for you really quickly. Let me know if I missed anything or if there's anything you remember you'd like to add, okay?
Yeah.
So you've had lower back pain going on for about 3 weeks. It first kind of started when you were helping a friend move. It's constant, but with some movements, it becomes sharp. Normally it's about a 4. It can get up to a 7. You said it gets worse when you twist and bend. Tylenol did help a little bit, but not too much. Heat was not really helpful. You tried topical gel as well. You don't have any other symptoms, but sometimes you do get a headache when it's really bad.
Yeah, exactly.
Perfect. So I'm just going to move on to your medical history just to get a better idea, okay?
Okay.
Have you been diagnosed with any illnesses?
No, pre-diabetes, so just to kind of like monitor my sugar levels, but no major diagnosis.
Okay, and when were you told you had prediabetes?
2 years ago.
2 years.
Mhm.
Okay. Are you prescribed any medications right now?
No prescription medications. I take a multivitamin.
Okay.
And then I take fish oil just for heart health.
Okay. Do you have any heart conditions?
No, it kind of runs in my family, so I'm trying to prevent it from happening.
Okay. Well, we'll touch on that in a minute.
Okay. No worries.
Any allergies?
No allergies. I get like a slight irritation to seafood, but nothing that is drastic.
Okay. Have you ever had any hospitalizations that required you to stay overnight?
No.
Okay. Have you ever had any surgeries?
No.
Okay. Perfect. Have you ever had any sort of trauma that required medical attention?
I was in a car accident a year and a half ago, and it didn't require medical attention, but I was evaluated by EMS when that happened.
Okay. And did you sustain any serious injuries?
No, just the regular body aches and stuff.
Okay.
Typical of it.
Have you had any recent travel?
No.
Okay. All right. Okay, just to touch on your reproductive history really quickly. When was your last menstrual cycle?
3 weeks ago.
And was that normal?
Pretty regular.
Okay. And have you ever been pregnant before?
No.
Okay. And have you ever been diagnosed with any reproductive problems? Like infertility or anything?
No, I haven't necessarily gone down that road. If I have any, I don't know them, so no, I haven't been diagnosed with anything.
Okay. And are you up to date with all your immunizations?
To my knowledge, yes.
Have you been vaccinated for COVID?
Yes.
And did you get your flu vaccine this year?
I have not gotten it yet, but it's on my to-do list for next week.
Okay, perfect. Maybe we can even take care of that at the end of the visit.
Oh, maybe. That'd be
Yeah.
great.
Did you have any youth illnesses?
I had asthma as a child growing up, but
Any chicken pox, measles?
no.
Okay.
I had the vaccines for those.
Perfect. And are you up to date on all your yearly checkups, appointments, Wellman's? Okay. Perfect. So really quickly, we're just going to touch on your family history.
Okay.
So I know you mentioned cardiac problems, but when I'm talking about family, I kind of mean your biological parents, grandparents, siblings, and you don't have any children, so we don't need to worry about that.
Okay.
So let's start on your maternal side.
Okay.
Any problems or health issues with your mom?
No, my mom's generally healthy. She has fibroids that she's dealing with now.
Okay.
But other than that, no other health issues.
How old was she when that first started?
She's 52 now. 51.
51. Okay. And her parents, do they have any sort of issues?
Her father is dead. He died of old age, natural causes. I don't think he had very many medical issues. And her mother is still alive, healthy. She has vertigo, but other than that, she's going strong.
Okay. And what about your father?
Father kind of has a little bit more family history. I mean, like medical history issues. He has like a lot of like heart issues. He recently had a cabbage, the heart surgery.
How old was he when he first started getting diagnosed with heart issues?
Late 30s.
Okay.
Yeah.
And what about his mother?
Mother also had heart issues. I don't know when she was diagnosed with it, but she died of like heart complications when she was 70.
70. Okay. And what about your paternal grandfather?
He died pretty late. He died in 95, 96.
Okay.
I think like from like Alzheimer's, dementia, but at the same time he was 95. So.
Okay. Any siblings?
I have a brother.
And is your brother healthy? Any health conditions?
He is generally healthy. He was told he had high cholesterol when he was like 17, but he managed it with food and diet, and now he's perfectly fine.
Okay. Any history of drug abuse in your family?
No.
Alcohol abuse?
No.
Or psychological illnesses?
No.
Okay. All right, we're gonna move on to your social history, so some of this could be a little bit more sensitive, but all of it is confidential and stay between you and me, okay?
Okay.
Okay, so how would you describe your home life?
I live by myself right now. I go to work, go to school.
What do you do for work?
I am a vet tech.
You're a vet tech?
Yes.
Okay. What kind of school do you have to go to for that?
Right now I'm in college. So I guess just the high school's diploma for it, but hopefully once I finish that, I can go out and go to vet school.
Okay. So what are you doing for school right now?
I am a bio major.
Oh, nice. I'm sure that makes you really busy, especially with work too. So do you find that you're able to get your like diet and exercise in, everything good?
Well, my diet could be a little bit better. Typically, it's a lot of just like easy fast food that I can make. I try to stay away from fast food, but at the same time, I'm not the biggest fan of vegetables, so I can incorporate a few more of those into my meals.
I would definitely recommend that.
Yes. I'm trying to subtly just sneak in more as I make things. Exercise-wise, I stay pretty active. You know, I try to work out a couple times a week.
Perfect. And as far as like your support system goes, do you feel like you have a good support system?
If I need, I can like turn to some friends. I'm kind of new to the area, so
Still trying to figure it out.
Still trying to figure that out a little bit, but hopefully I'll make more and find some relationships.
You seem like a very friendly person, so I'm sure you won't have any problems.
Thank you.
Okay, and do you smoke at all?
No.
No. Okay. Have you ever smoked before?
I have like tried marijuana a couple of times.
Okay.
It wasn't for me, so didn't do that. I don't like smoke cigarettes. That just seems gross to me.
And with the marijuana, about how often did you try it?
I tried it like twice, a year and a half ago, and then it just
Wasn't for you?
It wasn't for me.
Okay.
And I just, no, never since then.
Have you ever used any other tobacco products?
No.
Okay. Okay, so you did mention the marijuana. Any other recreational drug use or just that?
No, just that.
Okay, perfect. And that does include drugs that you take that are prescription that aren't prescribed to you, anything like that?
No.
And what about alcohol? Do you drink at all?
Yeah, I drink sometimes.
Okay, no problem.
Just when you go to the regular party every other weekend, have maybe like 4-ish drinks, but it's pretty infrequent that I do it.
Okay.
Yeah.
And you said about 4 drinks.
Yeah.
What exactly are you drinking usually?
Mostly mixed drinks.
Mixed drinks. Okay.
Yeah.
All right. Okay. Now, I do need to ask you a couple questions about your sexual history. So, are you sexually active?
Yes.
Okay. And with how many partners?
Just one, my boyfriend.
Just one.
Yeah.
Okay.
Mm-hmm.
And do you practice protected sex?
No. Well, yeah, I'm on birth control. We got tested just to make sure that none of us have anything, so we don't use condoms anymore. But
Okay.
yeah, I'm still on birth control because I'm not trying to get pregnant.
Okay.
Yeah.
All right. Perfect. Okay, we're gonna move on to just a review of some symptoms. So just a bunch of rapid fire, quick yes or no questions.
Mhm.
So just let me know if you've had them within the last 2 weeks to 2 months. Okay.
Okay.
Any fever?
No.
Any weight loss?
No.
Appetite changes?
No.
Night sweats?
No.
Fatigue?
No.
Okay. Any sort of weakness?
Well, except for like the back pain that's like limiting me. Otherwise, no. Like
Okay.
yeah.
Any sort of like just feeling of being unwell?
Mm-mm.
Okay. Have you noticed any? Did you? Okay. Like excessive thirst?
Mm-mm.
Have you noticed like any excessive need to like urinate?
No.
Have you noticed any sort of skin lesions?
No.
Okay. Any like moles that have changed?
No, I don't think so.
Okay. Hair loss?
I lose hair, but I don't think it's
Not
not
normal.
a normal amount. I have a lot of hair, so I lose a lot of hair.
Okay.
Yeah.
What about, what's the other one? We're moving on. Okay, what about any earaches?
No.
Any loss of hearing?
Mm-mm.
Okay. Any loss of vision?
No.
Okay. And any sort of like abnormal discharge from your eyes?
Mm-mm.
Okay. From your nose, runny nose at all? What about like bloody noses?
Mm-mm.
Okay. Have you had a sore throat?
No.
Or like any hoarseness?
It was hoarse like a week ago, but that's because I think I went to a concert and kind of brought it upon
That will
myself.
do it.
Yeah, so I don't think it has anything to do with anything else, and then it resolved after 2 days, so
Okay.
it's fine.
Any headache?
I get a headache occasionally with
With
back
the back
pain.
pain?
Yeah, just
That's right.
but
You did say that.
it's fine. It's not like crazy.
Okay. And then any like dizziness, vertigo?
No.
Okay. Have you had any sort of mental status changes?
What do you mean by that?
Depression, anxiety?
No, not that I'm no.
Okay. Any like suicidal thoughts?
No.
Homicidal thoughts?
No,
Okay,
no,
good.
none of those.
Okay, perfect.
Thankfully.
Yes. Have you noticed any chest pain at all?
No.
Any like feeling of your heart racing when it shouldn't be?
No, I mean I get the heart racing thing when I work out, but
Okay, that's pretty
I feel like that's supposed to happen.
Any difficulty breathing?
Mm-mm.
Okay. Any sort of cough or anything like that? Okay. Have you noticed any abnormal bruising?
No.
Okay. And any bleeding that's lasting longer than it's supposed to?
I don't think so.
Okay. All right. Have you noticed any sort of poor circulation?
What do you mean by that?
Like your hands and toes getting colder, numb, and tingly when
My fingers get cold and stuff in general, but I don't.
Not more than usual.
No, not more than usual. I've never been told that I have like
Portion of it.
decreased circulation or anything.
What about abnormal muscle cramps?
Mm-mm.
Okay. Have you had any sort of stomach aches?
No.
Okay. Have you had any blood in your stool?
No.
Okay, perfect.
That'd be
That's
helpful.
good. And what about your urine? Blood.
Blood in my urine? No.
No. And no painful urination or anything?
No. No
Um,
UTI for me.
What about pelvic pain?
No.
Okay. And then I did ask you about your menstrual cycle. You said it was normal, right? Nothing
Normal?
abnormal?
Yeah. No. Nothing abnormal from it. Pretty regular, I think.